Hello everybody, Jack here, the Rheumatology Physio, and in this video what we're going to do is talk about how to hack your knee replacement, or basically get the most out of your knee replacement. And I'm going to show you some variations on exercises in order to get the most out of this and get over some of the sticky points. So we're just going to start off here. These are sort of fairly normal exercises. I'm going to go through these very briefly. It's the squat, and this is a really useful exercise for strengthening your knee and your quadriceps, which extend the knee. So this is going to help us get on and off chairs, up and down stairs, that kind of thing. And this is sort of the normal version of the squat. And this is great. But after a knee replacement, we can have some minor issues. So here we are with a weight, and this would be progression. And obviously, the more weight you add, the harder it is to get up and down off of the bench. And this is great because that is what is going to strengthen us up, and that is what is going to improve the function of that knee. Now, after a knee replacement, certainly early on, we typically are going to be lacking what we call flexion of the knee. So that's how much the knee bends. But we're also going to be lacking strength in the knee. So what I'm going to do is I'm going to show you some variations on the squat in order to get around this and improve flexion of the knee as well. So the first thing we're going to do, if you're struggling to get all the way down to the bench, we're just going to very simply add a cushion. And what this does is this allows us to then perform the squatting exercise without quite so much flexion in the knee. That's better seen from the side-on view, which is coming up right now. So as you can see on the squat here, my knee is not bending quite as much as I sit on the cushion because I'm not going so deep down onto the chair. And this allows us to perform that exercise without putting so much stress bending the knee. And we can add weight to that as well. And I actually really like this on the early stages of the rehab from the total knee replacement in order to get some loaded flexion into the knee without going too far into that range of motion, without bending it too much. Certainly early on you can have some issues with the scar and the staples and all that kind of thing after the surgery. So this allows us to restrict that but start loading through the knee. So that's a great thing to start really early. Now, this variation of the exercise is one of my favorites. So once you've got some range of motion back in the flexion of the knee, but you're weak at the bottom of the range of motion, so the hardest part is going from the sitting bit to the standing bit. Now, the band means all the resistance is higher up, so you can really load the quadricep, but not early on in the movement. So this is an early variation of the squat after the total knee replacement, and good to start as soon as possible. So you can see we're getting down to about 90 degrees of knee flexion, the bending of the knee, but the load, because of the stretchiness of the band, is all at the top. So you can get a lot of stress through the muscle, but without bending the knees, without the stress through the bent part of the knee. And you can do the same thing if you haven't got the full range of motion. Again, you can add the cushion. So you can see what happens is, as I stand up, the band stretches, but it is not particularly stretching in the lower part of the exercise. So your knee is more unloaded at the beginning and then higher loading at the end. So you can get some really good strength into the muscles, but without actually loading the knee at that really low point of the flexion. Really good exercise this. This is one of my absolute favorites. Gets the strengthening going much earlier in the process. Now, this is actually my favorite hack. So here you can see what I've done. I've got a weight plate here to elevate my foot. But what this does, this elevates the foot and gives you more knee flexion as you sit down into the squat. But you don't have to go lower down towards the floor, so you're less likely to get stuck. And this has two really good benefits. One, you can really push that knee into flexions. This is a bit later on in the rehab process, but you can see I'm really pushing that knee into flexion. And then finally, when you start to add a lot of load, what you're going to do is really strengthen that lower part of the motion where the knee is really flexed, so the hardest part. So you're going to really try to weight bear as much through that elevated leg as you can, and the other leg is just there to help if needed. And you're really going to get down low. It's going to stretch that knee into flexion, and then you're going to load it right up as you stand back up again. Absolutely love this hack. This is a really good way of generating a lot of force through the knee without causing yourself a logistical struggle by getting down low to the floor. So I hope you found that video useful. Please do comment and give me any feedback or what you thought about the video. If you've got any questions or queries, or if you want me to record videos on any other types of exercise for arthritis or knee replacements, so on and so forth, I'm absolutely delighted to do that. Please do like, comment, share, and we can get these to the people that need them. I'll see you on the next video.